you as a caregiver or as a parent, you can make a better decision on behalf of your child. Oral health care is pricey. It is not as comfortable as we would want to make it look. Hello guys, Dr. Kendi here, and welcome back to another episode of My Oral Health Diaries. We're finally done with January, and now we are into February, and we're very excited because this month we're going to be focusing on pediatric oral health or children's oral health. Why is this month so very special to us? During this month, we are going to be raising awareness on why it is important to educate children on good oral health habits so that they can have a lifetime of healthy smiles. For me, it is very, very special because I also had like quite a bit of work done when I was younger, so I appreciate the role that pediatric dentists play. So joining us today on this episode is my colleague and friend. He's going to introduce himself, and then we are going to continue with our discussion today. Welcome, Dr. Munyo. So you can introduce yourself.
Thank you.
Yes. Yes.
So my name is Dr. Thomas Munyo Jr., a pediatric dentist by training for the past 6 years. Prior to that, I was just a general dentist, but obviously you have to go back to school. My passions are basically in dentistry, treating children, and doing fixed orthodontics, or what most people call braces.
So now maybe what we can discuss is what is the difference between a general dentist and a pediatric dentist? Is there a difference?
The major difference is that a pediatric dentist has undergone more training compared to a general dentist. Basically, for you to become a pediatric dentist, you have to do an DDS course, that's in America, or an MDS course in the British system, whereby you have to be in school for a minimum of 3.5 years for you to get more training in pediatric patient management, in terms of prevention of dental diseases in children, and also in terms of care for special needs people, which you do not get that when you're doing your undergraduate training.
Yeah. Did you know from the beginning that you wanted to become a pediatric dentist, or is this something you decided later on?
To be honest, no. Actually, I never knew I was going to become a dentist in the first place. My aspirations were to become a civil engineer. I found myself in dentistry, and as I did dentistry, basically I had a passion for prosthetic dentistry more than pediatric, but as dental school does to you as a person, you end up changing your career line. Actually, I thought I was going to do maxillofacial, but after doing my internship in Kenyatta, I was like, I think pediatric dentistry is the way to go. I was there. My colleagues in that department were so nice and passionate about their work, and that's why I really got motivated to help the children in our country. Because I saw there's a big need for pediatric services in our country. A lot of children suffer in this country. A lot of children undergo abuse in the form of dental neglect, which if you are in European countries, some of those things that we ignore, like a child having an abscess or even dental caries, a parent can easily lose custody of the child. But it's because in our country, our laws are not fully implemented.
Yeah, I totally relate with you. Like the fact that in Kenya we don't have, I don't know if it's awareness, low socioeconomic status, I don't know, but there's a problem basically with reaching out to get oral health care.
There is a big problem. There are laws, by the way, there are laws which have been passed in the constitution, but there are laws about child abuse, neglect, but the problem is that they're not being implemented.
So if I don't take my child to the dentist when they have an infection, that is me breaking the law.
Yeah, you're actually causing physical harm to the child. The child is suffering, the child is in pain. It's the same way when you come with a cigar and decide to burn a child's hand. So that's abuse. The same way a child has an abscess and you just tell them, go and sleep and give your Panadol, that's neglect.
That's neglect.
Yeah. Ideally, it means you're not able to take care of that child. You don't have the passion or even the compassion to raise that child well. So why should you be left with that child in the first place?
So you have grown to really like pediatric dentistry, yes? experience so far? Like something that is super memorable as a pediatric dentist that you've encountered that you can share with us?
I think the smile that I see on the parents' face, not even the children,
the parents
after a treatment, or when you're doing like something like a full mouth rehabilitation, that's whereby you find a child has multiple cavities, a child who is malnourished because of having multiple cavities and generally abscesses in the mouth. Once you complete that treatment, you can see the smile on the parent's face. Even after a few months after the treatment, you see the way the child is now well nourished. From that tiny child now to something more bigger and more healthier. Usually that gives me joy. And some kids come running to hug me.
Yeah.
You know, you feel weird being an African man, you're like, you're not meant to show emotions, but a kid is hugging you as if it's your own kid. It touches you.
Yeah.
It really touches you.
I agree. I mean, I'm a GP, but I enjoy treating children because then also they don't shout at you. They don't threaten you.
They scream at you.
Oh, you're screaming, yeah.
They scream at you. Some women can call you names, but you know where those names have gotten them from.
Yeah.
But at least they are more accommodating, they are more understanding in a way compared to adult patients, and that's why I enjoy pediatric dentistry more. Because the parents really take care, are really more concerned about their children, will do anything for their kids.
Yeah.
Yeah, and they're usually more committed and motivated to ensure their kids are okay.
Yeah.
That's what usually makes it more easier.
Yeah.
But sometimes you can find an adult who decide to neglect themselves for the sake of the child. So you say pediatric dentistry is one of the best things. It's more
very fulfilling.
Yeah.
And like you guys are playing a very big and important role in oral health care because it's like the foundation of dentistry. Yeah. If a child is able to learn how to take care of their oral health early, then it's better because they will be able to take care of their teeth, they'll be brushing properly, and they'll have a positive oral health care seeking behavior. So these guys are playing a big role. Remember, it's February, so it's your time to appreciate your pediatric oral health care provider, gift them, bring your children, you know, all that kind of stuff. Yeah. So, Dr. you've mentioned that it's pediatrics and special care.
Yes.
So what does special care entail?
Special care basically entails taking care of people or even children. Actually, children and adults, yeah? Because also the adults who have special needs. Special needs basically means people who have certain conditions that impair them from taking care of themselves.
Yes.
For example, people who have mental retardation. Common things that we see in our society nowadays is things like cerebral palsy, which is quite common. Those children are not able to take care of themselves. So that's where we come in. We try and guide the caregivers on how to take care of those teeth so as to minimize chances of them getting cavities. Because you know, when a child with special care needs once they get a cavity, doing the restorations or the fillings within the dental setup becomes very hard. So most of the times you have to go to theatre. Also other conditions that fall within this general group of special needs are things like autism, autistic children, and there are quite many nowadays. Even you have special needs schools in Nairobi and in the country at large. Also children who have Down syndrome, it's also very common. So all those guys fall under the special needs category and you have to take care of them.
Okay, so like here, since we're in Kenya, do you feel like we have grown enough, or have we created a good platform to be able to take care of special needs patients? Or do you feel like there's a big demand? Are we falling back?
Generally, I would say there's a big gap in terms of where we're meant to be.
Yeah.
Falling back, generally, I would say, okay, I'm not being biased, but healthcare in Kenya has improved slightly, but there's some negatives that have really happened over the past few years because of due to certain government policies that are not favoring the retention of well-trained healthcare professionals. So basically, we're going to have a negative effect. Also, failure by our government to invest adequately in the systems that have been put in place in certain hospitals to enable us to carry out the required services by this special group. So I would say basically government hasn't put in a lot of effort in this field. And not only in that area, but generally dentistry in general. The evolution helped a lot in that most of the governors tried setting up a dental clinic everywhere in the county, but what they lacked was the personnel.
Personnel.
They lacked the personnel.
By the time us younger dentists were coming into the field, there was basically there were no jobs. There are hospitals.
The facilities are
there.
The equipment, some of the equipments are there, but there is no personnel. Yet the personnel is outside. Basically, there's no absorption of personnel due to certain government policies. But there's a big gap and there's a big demand. Because even I keep getting calls, some of my colleagues keep getting calls from schools that they need camps for these special needs children, even the adults who require special needs care. Because these children usually graduate to become adults. And you'll find we are the same people, the pediatric dentists
who need to take care of
them. So there's a big need. Unfortunately, our government has not invested in that, and also healthcare generally. Because you're not even meeting the required 15% of the budget that is meant to be set aside by the government to be channeling to healthcare in the country. We're not even doing that. It's a big need. It's painful. It's really painful. Even when you talk to the parents, they pay than go in order to get even basic services that the kids should be getting. It's really painful and sad. I hope Kenyans will just one day wake up and realize we need better leaders in our country, because policy making starts from our leaders, not from the professionals. It's our leaders. We'll come up with ideas, we'll suggest ideas, but it's up to them to implement. So if you don't have any political goodwill,
it becomes a challenge. So there's the private sector and now the public sector. So most parents would come and say that I do not have enough money to get access to this, especially like with pediatric oral health care and special needs care. It tends to be a bit pricey because of the way the procedures are very intricate, and as you mentioned, you need quite a bit of equipment here. So would you say, like in terms of public transit and the public sector, is there a hospital as per now that has been equipped to fully manage special care and pediatric children's needs?
I can only think of two institutions where I've actually seen special needs kids being taken care of. That is Kenyatta National Hospital and the School of Dental Sciences, that is dental school. I'm not sure about Moi Teaching and Referral Hospital because I personally have not been there, so I wouldn't comment, but I know they also take care of kids with special needs because they have a university, and within the university they have some specialists who are there, and the specialists are well equipped in terms of their training to manage such individuals. And also Madare also sees some of the special needs patients here. But the two top ones are Kenyatta and School of Dental Sciences, because there's a higher concentration of specialists within those two facilities. And the prices are usually subsidized by the government. They're not pricey as such. Generally, dental is expensive everywhere, except in Kenya. But if you go to Europe,
are we underpricing?
Yes, we underprice a lot because of environmental factors and also external factors for insurance and etc. But if you go to Europe and America, and even in Africa, if you go to Namibia and South Africa, you'll find the prices vary a lot. We have a high concentration in those two facilities. Is it enough? We are far from being enough. If you compare ourselves with other African countries like Egypt, I think there are more than 200 pediatric dentists. That's a big amount.
How many pediatric dentists are there in Kenya?
I don't know the number offhand, but I think we're less than 40.
Wow.
We're not many. We're less than 40.
With a population of how many Kenyans could we be? And
we're heading towards 50 million Kenyans.
And children
at the bulk, the youth the bulk of the population. So we are not many. We are not many. So you can see already
there's a challenge. Okay, so as we are finishing up on this introduction to pediatric oral health care, maybe we can discuss the major challenges that we have seen face children with regards to oral health in Kenya specifically. So maybe we'll just have a discussion with Doc, since you see a lot of children. What do you feel are like the major issues here?
From the basics, poor oral hygiene. That basically means kids are not brushing their teeth, caregivers are not bothered. They think maybe you should start brushing your teeth when you're going to school.
Yeah.
That is when you're now going to PP1, which is 4 years.
Because they don't know dentally.
They don't know, and that is because of poor policy making.
Yeah.
Because when the mother or the caregivers are going for that prenatal checkup, ideally the gynecologist or the nurse should at least tell them there's something called teeth that will grow at a certain age, yeah? And this is what you need to do when the teeth grow. But unfortunately, they don't do that, yeah? They just go check the fetal heart rate and all those things. I tell them, Mom, your baby's okay, you can go home. But they forget to educate them on how to take care of these children when they now start growing and developing.
Yes.
Especially on the oral aspect.
Yeah.
So that's a big challenge. So you see, when you don't educate the parent, there is some form of ignorance.
Yeah.
And now this leads to poor oral hygiene, now that progresses to dental caries, which is quite common in children. And usually say that when a child has, if you have a child who has, the number of cavities are more than the age of the child, we classify it as early childhood caries. In children who are under the age of 6 years, which is not good. It's a bad sign, because once a child has cavities in their baby teeth, or what you call deciduous teeth, there's a higher probability to progress to their permanent teeth. Yeah. So those are the things that mothers need to be educated on. Also, the common problems are abscesses because of those dental
The infections.
They
are really severe.
They're really severe. Some kids get admitted, some have to take to theatre, some develop bone infections because of just a small tooth. They call it a small tooth. Actually, a lot of people say in society, imani ya mtoto. Itatoka. Those are the same things that can make your child be admitted.
Yeah.
And also malnutrition. Obviously, if your child has bad teeth, they're not able to feed well, so they end up developing malnutrition.
Is there just like a challenge with nutrition in Kenya? Are we educating our mothers well enough on how to feed the children, what to feed them, what to avoid, the duration? Do you think there's enough education?
Not really. We just usually focus on how long you're meant to breastfeed for, when to introduce weaning. Yeah. That's what usually we focus on. But even the duration of breastfeeding actually is not clearly well defined. Yeah. Like if you follow the American Dental Association or American Association of Pediatric Dentists, AAPD, nowadays they're trying to recommend for parents to breastfeed only for a period of 1 year.
That's the recommended.
Yeah, because
1 year.
See, but by 1 year, at least the child is able to eat. You've already started weaning at 6 months, yeah?
That's what we do. The myths out here, the myths are crazy.
Yeah, because now I see even parents even breastfeeding up to 3 years. But now you see those parents who breastfeed up to 3 years, there's a higher percentage of them, of the kids who end up developing cavities. Yes. Because breast milk and milk in general, then you give in nursing bottles, milk is generally a sugar. Yeah. So this child is just on sugar throughout, and you're not brushing their teeth. They'll end up developing cavities. You find even children as young as 2 years, or even 1.5 already have decay. And they won't cooperate on the dental chair, so you have to go to theatre, which increases the cost tremendously. Because taking a child just to theatre, let's say in a private facility, you need a minimum of about 200,000 Kenya shillings. Yeah. So that's so expensive, and that's something a parent will have avoided by just saying, imetosha, let's stop breastfeeding, let's continue the normal foods and just brush your teeth. Yeah. Okay. So we usually recommend 1 year, but humans are different, people are different, some people are difficult, so those ones will continue breastfeeding, because for some mothers, the child is like their source of comfort, source of joy. Yeah. So they want to stay attached to the child. They never want to let go. By breastfeeding. Yes. Okay. So we have said the biggest challenge is hygiene. Very severe infections, and then of course we've talked about poor dietary habits. Yeah. Do you think that also the socioeconomic status plays a role in terms of accessing of oral health care for children? Yes, it does, a big role. Because not in a bad way, As I mentioned earlier, remember I said there are 2 facilities that are well equipped. There the prices are way less than the private facilities. Yes, you'll get good services in those facilities, but the problem is the waiting time.
Yes.
You'll find like a child needs maybe a root canal. They might be told to come after 2-3 months. You see now that one, you end up having to extract, because some parents are usually so impatient, they end up going to other facilities just to extract. If you come to a private facility, the treatment can be done either the same day or after a few days after medication. But you'll end up paying like maybe 5 times more than in a government facility. So socioeconomic status contributes a lot. Big role in terms of you being able to afford services, you being able to get treatment on time, and also on the kind of meal or foods you give your children. Because it has been shown, studies have shown that in most slum areas, kids tend to snack a lot and take a lot of sugary things, and starch a lot of starch, which contributes to development of dental caries, and also due to lack of awareness.
Yes. Okay. So I know we've discussed so much, but what we are trying to say here is that awareness is very, very important. You as a caregiver or as a parent, you can make a better decision on behalf of your child. Oral health care is pricey. It is not as comfortable as we would want to make it look. So you really can make a big difference in your child's life by just making a better decision. So thank you so much for joining us on today's episode of My Oral Health Diaries. I hope you learned something. We've just had a general basic discussion. So next time we're going to dive deeper and discuss about oral hygiene, which, as Dr. Munyao has clearly pointed out, is a major problem in oral health care in the KE. Make sure you join us next time, and thank you so much for keeping it locked to My Oral Health Diaries. Kindly keep subscribing, keep liking, keep sharing, and thank you so much for your support. We'll see you again next time. Should I continue nodding? Great.
For 20 minutes.
For 20 minutes? I nod for 20 minutes? Are you kidding me? I was nodding like this for 20 minutes. I continue